Most people think high blood pressure comes with warning signs: a pounding headache, dizziness, blurred vision, a feeling that something is wrong. But what if I told you that the most dangerous blood pressure damage often happens when you're asleep? Not while you're walking, not while you're exercising, not while you're sitting in your doctor's office, while you're sleeping peacefully in your own bed. And the most frightening part? You may feel absolutely nothing, no symptoms, no warning, no clue that damage is happening. After spending decades working with older adults and reviewing cardiovascular cases, I've seen the same pattern again and again. People assume that a normal blood pressure reading during the day means everything is fine. But for millions of adults over 60, that's simply not true. In fact, some people have perfectly normal daytime readings, while their blood pressure quietly climbs to dangerous levels in the middle of the night. And because nobody is measuring it, nobody knows it's happening. Until one day something changes. A stroke, a heart attack, kidney damage, or a serious cardiovascular event that seems to come out of nowhere. But it doesn't come out of nowhere. The warning signs were there. They just weren't being measured. Today, I'm going to show you why nighttime blood pressure may be even more important than daytime blood pressure. You'll learn why more than half of adults over 65 are carrying a hidden cardiovascular risk they don't even know about. You'll discover 3 common things inside your own home that may be silently raising your blood pressure while you sleep. And before we finish, I'll share 3 specific tests that could reveal what your standard doctor's appointment completely misses. One of those tests takes just 24 hours and can completely change how your cardiovascular risk is understood. But first, you need to understand something that most people have never been told. Healthy blood pressure isn't supposed to stay the same all day and all night. Your body was designed to follow a rhythm, and when that rhythm disappears, the consequences can be far more serious than most people realize. Let's start with something that surprises almost everyone. Your blood pressure is not supposed to remain constant while you sleep. In fact, under normal conditions, something remarkable happens every single night. As you drift into deeper stages of sleep, your blood pressure naturally drops by about 10 to 20%. Doctors call this the nighttime dipping pattern, and it's one of the most important protective mechanisms in your entire cardiovascular system. Think of it like a maintenance window. During the day, your heart works harder. You're moving, walking, thinking, reacting. Your body needs higher pressure to support those activities. But at night, everything changes. Your heart gets a chance to recover. Your blood vessels relax. Your kidneys perform important filtration work. Your entire cardiovascular system enters a period of repair and restoration. And all of that depends on your blood pressure falling during sleep. But here's where things become concerning. As we age, that natural dipping pattern often begins to disappear. Your arteries gradually become stiffer. Your blood vessels lose some of their flexibility, and the autonomic nervous system, the system responsible for regulating blood pressure while you sleep, becomes less efficient. The signals that once told your blood pressure to drop at night become weaker, less reliable, more inconsistent. For millions of adults over 60, the nighttime dip becomes smaller and smaller, and eventually, it disappears altogether. Instead of dropping during sleep, blood pressure stays elevated. In some people, it actually rises. And that's when the real danger begins. Because unlike daytime high blood pressure, nighttime hypertension often produces no symptoms at all. You don't feel it. You don't notice it. You simply wake up the next morning assuming everything is normal. Maybe you're a little tired. Maybe your head feels slightly foggy. Maybe you assume you just didn't sleep well. But what if something else is happening? What if your cardiovascular system spent the entire night under stress while you slept peacefully? Most people never consider that possibility, and most doctors never measure it, because they're only seeing a tiny snapshot of your blood pressure during an office visit, a few seconds out of an entire day, which raises an important question. If your daytime blood pressure looks normal, how can you know what's really happening while you sleep? The answer may shock you, because one patient with a perfect blood pressure reading during the day discovered something terrifying after wearing a monitor for just one night. And what it revealed completely changed how his risk was understood. Let me tell you about a patient I'll never forget. He was 68 years old, active, independent. He walked every morning, maintained a healthy weight, and every time he visited his doctor, his blood pressure looked excellent. One afternoon, during a routine checkup, his reading was 120/78, textbook perfect. Most people would have celebrated that number, and honestly, so would most doctors. But something didn't quite fit. He kept mentioning that he woke up exhausted, not occasionally, almost every day. He also described a strange morning fog, not dizziness, not confusion, just a feeling that his brain wasn't fully awake. His daytime blood pressure looked normal. His lab work looked normal. Nothing obvious explained what he was experiencing. So his physician recommended a 24-hour ambulatory blood pressure monitor. A small portable device that records blood pressure throughout the day and night while you live your normal life. He agreed. The next morning, the results came back, and they were shocking. During the day, his blood pressure remained perfectly controlled. But after midnight, something changed dramatically. At 1 a.m., it began rising. At 2 a.m., it climbed even higher. And by 3 a.m., his blood pressure had reached 164/102, while he slept, completely unaware, no symptoms, no warning signs, nothing. For several hours every night, his cardiovascular system was operating under dangerous pressure levels. Night after night, week after week, month after month. That discovery changed everything. Because his doctor now understood that the problem wasn't his daytime blood pressure. The problem was what happened while he slept. And here's the part that should concern every adult over 60. This situation is not rare. In fact, doctors have a name for people whose blood pressure fails to drop normally during sleep. They're called non-dippers. And research suggests that more than half of adults over 65 may fall into this category. More than half. Not a small group, not an unusual condition, millions of people, many of them feeling perfectly fine. The question is why? Why does blood pressure stay elevated during sleep? Why do some people lose that protective nighttime dip? And why does the risk become so much greater after age 60? The answer involves 3 hidden factors that affect millions of people every single night without them realizing it. And the first one may already be sitting inside your medicine cabinet. So what causes blood pressure to stay elevated while you're sleeping? There are several reasons, but 3 stand out because they're surprisingly common, especially after age 60, and most people have no idea they're happening. The first factor is medication timing. Many people take their blood pressure medication first thing in the morning. That's the standard routine. Take the pill with breakfast and move on with your day. Simple, convenient. But here's the problem. Most medications have a peak period when they're working at their strongest. Then, gradually, their effect begins to fade, hour by hour. If you take your medication at 7 o'clock in the morning, by midnight, a significant portion of that protection may already be gone. And what happens next? Your blood pressure begins drifting upward right when your body needs protection the most. That doesn't mean everyone should take medication at night. Far from it. Some medications, especially diuretics, may be completely inappropriate before bed. But it does mean timing deserves a conversation many patients never have. The second factor involves stress hormones, specifically cortisol and adrenaline. Under normal circumstances, these hormones should decrease during sleep. Your body is supposed to enter a calmer state, a recovery state. But as people age, those rhythms sometimes become disrupted. Instead of falling overnight, cortisol levels may remain elevated, or even spike unexpectedly. When that happens, blood pressure often follows. The heart beats harder, the blood vessels tighten, and pressure rises, all while you're asleep. The third factor is fragmented sleep. This one is incredibly common. Many older adults wake briefly multiple times throughout the night without even remembering it. A trip to the bathroom, a noise, a moment of discomfort, a breathing disturbance. Each awakening triggers a small activation of the nervous system. Your body shifts into alert mode. Your heart rate increases. Your blood pressure jumps. Then it happens again, and again, and again. One night might not matter much, but thousands of nights over years? That's a very different story, because every surge creates additional strain on your cardiovascular system. And that's why doctors pay so much attention to something called the dipping pattern. When that pattern disappears, the risks increase dramatically. In fact, people who fail to experience a normal nighttime dip carry significantly higher risks of heart disease, stroke, kidney damage, and cardiovascular death, even when their daytime blood pressure looks perfectly normal. And there's an even more dangerous group. People whose blood pressure doesn't just stay elevated, it actually rises while they sleep. Doctors call them reverse dippers, and their risk is even higher. So now the obvious question becomes, how can you know whether you're a normal dipper, a non-dipper, or a reverse dipper? Fortunately, there is a test specifically designed to answer that question, and surprisingly, most adults over 60 have never been offered it. The test is called ABPM, which stands for Ambulatory Blood Pressure Monitoring, and if you've never heard of it before, you're not alone. Despite being considered one of the most valuable tools for detecting hidden blood pressure problems, most adults over 60 have never been offered one. Here's how it works. Instead of measuring your blood pressure once during a doctor's visit, you wear a small portable monitor for 24 hours. The device automatically checks your blood pressure every 20 to 30 minutes during the day and throughout the night while you sleep. You go about your normal routine. You eat, you walk, you watch television, you sleep, and the monitor quietly records what your cardiovascular system is doing every step of the way. What makes ABPM so powerful is that it captures the information a standard office visit completely misses. It shows how high your pressure climbs during daily activities, whether your medication lasts long enough, whether your pressure falls properly at night, whether you're a normal dipper, non-dipper, or reverse dipper. In many cases, the results are eye-opening. A person may have normal readings every time they visit the doctor, yet ABPM reveals dangerous nighttime hypertension. Others discover that their medication works beautifully during the day, but loses effectiveness during the overnight hours. And some learn that their blood pressure is rising while they sleep without producing a single symptom. That's why many cardiovascular specialists consider ABPM the gold standard for understanding true blood pressure patterns. But surprisingly, most patients never receive one unless they specifically ask. And that's important, because if you don't know what your blood pressure is doing during the 8 hours you spend asleep, you're missing 1/3 of the entire picture. But ABPM isn't the only test worth knowing about. There are 2 additional tests that can reveal silent damage long before traditional lab work shows a problem. One of them can detect early kidney stress years before kidney function begins to decline. The other can reveal damage occurring inside your arteries before symptoms appear. Together, these tests provide a much clearer picture of what's really happening inside your cardiovascular system. And most people have never heard of either one. Let's talk about the 2 blood pressure tests that almost nobody discusses. Because identifying a problem is important, but detecting damage early is even more important. The first test is called urine microalbumin, and despite its simple name, it can reveal some of the earliest signs of blood pressure-related damage in the entire body. Here's why. Your kidneys contain millions of tiny filtering units. Think of them as microscopic strainers that continuously clean your blood. These filters are incredibly delicate, and high blood pressure puts stress on them every single day. At first, the damage is invisible. You feel normal. Your kidney function tests may still appear normal. Everything seems fine. But the tiny filters begin leaking small amounts of a protein called albumin into your urine. Not enough to notice. Not enough to create symptoms, but enough to measure. That's what microalbumin testing detects. It catches damage early, often years before traditional kidney tests show a problem. In other words, it acts like an early warning system, a signal that your blood vessels are under stress before permanent damage develops. And that's exactly why doctors value it, because early detection creates options. The second test is one that surprises many people. It's called oxidized LDL. Most people have heard of LDL cholesterol, the so-called bad cholesterol. But oxidized LDL is different. Think of it this way. Regular LDL is like metal. Oxidized LDL is like rusted metal. The cholesterol becomes damaged, inflamed, much more harmful to the lining of your arteries. And that's where the danger begins. As oxidized LDL accumulates, it contributes to plaque formation inside blood vessels. The arteries become stiffer, less flexible, less healthy. Over time, the risk of heart attack and stroke increases. What's interesting is that standard cholesterol panels usually don't measure oxidized LDL. Many people assume their cholesterol is under control. Meanwhile, oxidative damage may still be occurring. That's why some cardiovascular specialists view oxidized LDL as a valuable additional marker, especially for people with long-standing blood pressure concerns. Now imagine combining all 3 tools, ABPM, urine microalbumin, oxidized LDL. Together, they provide a much deeper understanding of cardiovascular health than a routine office blood pressure reading ever could. And once you know your numbers, the next step becomes obvious. How do you reduce the risk? Because identifying hidden danger is important, but changing the outcome is what really matters. And one of the most surprising answers may involve something as simple as when you take your medication. Now let's talk about one of the most surprising discoveries in modern blood pressure research. Not a new drug, not a new procedure, not an expensive treatment. Simply when medication is taken. For decades, most people were told to take their blood pressure medication in the morning. It became routine. Wake up, eat breakfast, take your pill, move on with your day. But researchers began asking an important question. If blood pressure problems are occurring at night, shouldn't treatment be protecting patients at night as well? That question led to one of the most discussed areas in cardiovascular medicine, chronotherapy, the science of timing medication to match the body's biological rhythms. Researchers followed thousands of patients over multiple years. They compared people taking their medication in the morning with people taking the same medication later in the day. The medications didn't change. The doses didn't change. Only the timing changed. And the results were remarkable. Patients whose treatment better covered the nighttime hours experienced significantly better cardiovascular outcomes. Fewer heart attacks, fewer strokes, lower cardiovascular risk. Now, this does not mean everyone should immediately switch their medication to bedtime. That would be a mistake. Different medications behave differently. Some blood pressure medicines are designed to work around the clock. Others are not. And certain medications, especially water pills, can create obvious problems if taken too close to bedtime. Nobody wants to wake up repeatedly throughout the night to use the bathroom. That's why this is a conversation for you and your physician. Not a decision to make alone, but it is absolutely a conversation worth having. In fact, one simple question at your next appointment could be, does the timing of my blood pressure medication provide adequate protection during the night? That question takes less than 10 seconds to ask, but the answer could completely change how your treatment plan is viewed. And while we're discussing nighttime protection, there's another topic that deserves attention. Something sitting quietly on the shelves of grocery stores and health food stores across the country. Something most people think of as just another herbal tea, yet researchers have studied it extensively because of its surprising effects on blood pressure. It's called hibiscus tea, and what the research found about it may surprise you. Let's talk about hibiscus tea, because whenever people hear the words herbal tea, they often assume we're talking about folklore or old home remedies. But hibiscus is different. Researchers have spent years studying it, and what they've discovered is genuinely interesting. Hibiscus contains natural compounds called anthocyanins. These are the same compounds that give foods like blueberries, blackberries, and pomegranates their rich color. Anthocyanins act as powerful antioxidants. They help reduce oxidative stress inside blood vessels. And that's important because oxidative stress contributes to arterial damage over time. But that's not the only reason hibiscus has attracted scientific attention. Researchers have found that hibiscus may also influence a pathway involved in blood pressure regulation. In simple terms, it appears to help blood vessels relax and function more efficiently. Multiple clinical studies have reported modest but meaningful reductions in blood pressure among people who consumed hibiscus regularly. Not overnight, not dramatically, but enough to attract serious medical interest. And that's the key point. Hibiscus is not a replacement for medication. It's not a miracle cure. It's not something that should be used without discussing it with your doctor, especially if you're already taking blood pressure medication. But it is an example of how small daily habits can support cardiovascular health over time. What's even more important than hibiscus itself is the larger lesson it teaches. Small choices matter. The tea you drink, the alcohol you consume, the timing of your medications, the quality of your sleep, the questions you ask your doctor. Each one may seem insignificant on its own, but together, they create your long-term cardiovascular future.